I also spoke to the Prime Minister of Barbados and the current chair of the Caribbean countries about the challenges faced by small island developing states in gaining access to test kits and other supplies. No country should be left behind. And I would like to use this opportunity to appreciate the strong leadership by the Prime Minister of Barbados steering the response in the Caribbean. Good morning, good afternoon, and good evening. Tomorrow, WHO is joining forces with many of the world's leading musicians, comedians, and humanitarians for the One World Together at Home, virtual, global, special. This is the result of a close collaboration with my good friend Hugh Evans from Global Citizens and the inspirational Lady Gaga to bring entertainment, joy, and hope into the homes of people all around the world whose lives have been turned upside down by the COVID-19 pandemic. I would also like to use this opportunity to thank Lady Gaga's mother, Cynthia Germanotta, who is our Goodwill Ambassador, who is doing a great job advocating for mental health around the world. And thank you so much, Lady Gaga, and thank you so much, Cynthia Germanotta, for your continued support and help. This is a family project, and we really appreciate for your commitment and dedication. This is an opportunity to express our solidarity with frontline health workers and to mobilize philanthropists, the private sector, and governments to support the COVID-19 Solidarity Response Fund, powered by the United Nations Foundation and the Swiss Philanthropy Foundation. So far, the Solidarity Response Fund has generated more than $150 million from more than 245,000 individuals, corporations, and foundations. These funds are helping us to buy personal protective equipment, lab diagnostics, and other essential supplies for the countries that need it most. So I would like to say thank you. Thank you so much. Thank you from our heart to those who have contributed. For further details about tomorrow's events, I'm delighted to welcome once again my friend and my brother, Hugh Evans, to say a few words, to be followed by the amazing Lady Gaga. Hugh, over to you. Thank you so much, Lady Gaga, and thank you, Hugh. I look forward to joining you and millions of people all over the world tomorrow for what I am sure will be a wonderful event. And I share what Lady Gaga said. What the world needs is love and solidarity. So please accept much gratitude and much love from myself, Lady Gaga, and Hugh Evans, and all our colleagues here. That's what the world needs. Again, what the world needs is love and solidarity to defeat this dangerous enemy. More than 2 million cases of COVID-19 have now been reported to WHO, and more than 135,000 people have lost their lives. While we mourn for those we have lost, we also celebrate those who have survived and the thousands of people who are now recovering. WHO is updating our guidance to include recommendations for caring for patients during their recovery period and after hospital discharge. We're encouraged that several countries in Europe and North America are now starting to plan how to ease social restrictions. We have said previously that easing these measures must be a gradual process. And we have spoken about the criteria that countries should consider. Yesterday, we published our guidance on considerations in adjusting public health and social measures, which we encourage countries to read and apply. But although we see encouraging signs in some countries, there are worrying trends in others. In the past week, there has been a 51% increase in the number of reported cases in my own continent, Africa, and a 60% increase in the number of reported deaths. With the current challenge of obtaining testing kits, it's likely that the real numbers are higher than reported. With WHO support, most countries in Africa now have the capacity to test for COVID-19, but there are still significant gaps in access to testing kits. We're working with partners to fill those gaps and help countries find the virus. The African Centers for Disease Control and Prevention announced yesterday that more than 1 million tests for COVID-19 will be rolled out across the continent starting next week. Strengthening and supporting African Union institutions like the African CDC will really help, not only for now, but also for future. To further strengthen support for Africa, earlier this afternoon I spoke with President Ramaphosa of South Africa, the current chair of the African Union, and Moussa Faki Mohammed, the chairperson of the African Union Commission, UN Secretary General Antonio Guterres, the managing director of the International Monetary Fund, Kristalina Georgieva, and the president of the World Bank, David Malpass. In addition to tests, we're also working hard to accelerate the development, production, and equitable distribution of a vaccine. Yesterday, I spoke to President Emmanuel Macron of France, Bill Gates, and other partners to discuss how to prevent another pandemic by getting vaccines from labs to people as fast as possible and as equitably as possible. The commitment from President Macron, from Bill Gates, and also from Prime Minister Boris Johnson is heartwarming. I also spoke to the Prime Minister of Barbados and the current chair of the Caribbean countries about the challenges faced by small island developing states in gaining access to test kits and other supplies. No country should be left behind. And I would like to use this opportunity to appreciate the strong leadership by the Prime Minister of Barbados steering the response in the Caribbean. Today, I also spoke to the President of the European Commission, Ursula von der Leyen, and the Prime Minister of Finland, Sanna Marin, about continuing efforts across Europe to fight the pandemic and support lives and livelihoods. The commitment from both leaders, President von der Leyen and Prime Minister of Finland, Marin, is very, very heartwarming again. I would like to clarify WHO's position on wet markets. Wet markets, as you know, are an important source of affordable food and livelihood for millions of people all over the world. But in many places, they have been poorly regulated and poorly maintained. WHO's position is that when these markets are allowed to reopen, it should only be on the condition that they conform to stringent food safety and hygiene standards. Governments must rigorously enforce bans on the sale and trade of wildlife for food. WHO has worked closely with the World Organization for Animal Health and the Food and Agriculture Organization, FAO, of the United Nations to develop guidance on the safe operation of markets. Because an estimated 70% of all new viruses come from animals, we also work together closely to understand and prevent pathogens crossing from animals to humans. Finally, WHO is committed to keeping the world informed in as many ways as possible, in as many languages as possible. Our Viber chatbot is now reaching 2.6 million people with reliable evidence-based information and is available in 16 languages. This week, we launched Tamil, Sinhala, Bulgarian, Greek, Italian, and Hungarian, and we plan to launch Polish and Bangla next week. I'm pleased to say that from Monday, we will be providing simultaneous interpretation for these press conferences in all official UN languages: Arabic, Chinese, French, Russian, and Spanish. And we are also planning to expand to include other languages like Swahili and Hindi. We look forward to having more journalists join us from all over the world. I thank you.